Every year, millions of seniors dutifully schedule their checkups, get their referrals, and sit through tests their doctors ordered, assuming more testing means better health. But here's something the medical establishment rarely advertises. Some of the most common screenings recommended to people over 60 are not only unnecessary, they can directly harm you. Not because your doctor wants to hurt you, but because medicine runs on protocols, and protocols don't always keep up with the science. Today, I'm walking you through 5 specific medical checkups I would personally skip if I were over 60, and what the latest research actually says about each one. I'm Dr. Sarah Mitchell, and this channel is built around one idea: that people over 60 deserve honest, evidence based health information, not outdated advice wrapped in medical jargon. If that sounds like what you've been looking for, hit subscribe so you never miss what we cover each week. Now, let's get into it, starting with the one that surprises people the most. The first checkup to reconsider is the full body CT scan. These scans are being marketed aggressively at imaging centers across the country as the ultimate health insurance. Walk in healthy, walk out knowing everything. The pitch is appealing, especially after 60 when you're more aware of what can go wrong. But science tells a very different story. A single full body CT scan exposes you to somewhere between 10 and 30 millisieverts of radiation. To put that in context, a standard chest X-ray exposes you to about zero point 0.1 millisieverts. That means one full body scan equals the radiation of roughly 100 to 300 chest X-rays combined. The National Cancer Institute has specifically noted that this dose of radiation meaningfully increases cancer risk, particularly in older adults whose cells are more sensitive to radiation damage than younger cells. But here's what really shocked me when I looked at the research more closely. Radiation isn't even the biggest concern. It's what happens after the scan. A landmark study published in JAMA Internal Medicine followed patients who underwent routine full-body CT scanning and found that 37% of them had an incidental finding, something the scan picked up that looked abnormal but turned out to be completely harmless. 1 in 3 patients went through an anxious medical cascade of follow-up scans, biopsies, consultations, and in some cases, surgery. For nothing. This is what researchers call overdiagnosis, finding something that would never have shortened your life or caused a single symptom, but treating it anyway and causing real harm in the process. The American College of Radiology does not recommend routine full-body CT scanning for people without symptoms, full stop. Now, if you're a current or former heavy smoker between the ages of 50 and 80, targeted low-dose lung CT screening is a different conversation entirely, Rio. That one has solid evidence behind it. But the general whole body scan being advertised at imaging centers as a wellness checkup? That's the one to walk away from. Comment below if you've been offered a full body scan or if your doctor has recommended one. I genuinely want to hear what you were told about the risks, because most people are told very little. The second checkup on this list is the routine annual EKG for patients without symptoms. An EKG, or electrocardiogram, records the electrical activity of your heart. Ordered every year at an annual physical, it sounds essential. But the American Heart Association and the American College of Cardiology have both concluded that routine EKGs in adults with no cardiac symptoms and no significant cardiovascular risk factors offer no meaningful benefit. The problem isn't the test itself. The problem is what happens when the result looks slightly off. In a low-risk, asymptomatic person, EKGs have a high rate of false positives. The test flags something unusual. Your doctor sends you to a cardiologist. The cardiologist orders a stress test and an echocardiogram. You spend weeks worrying, scheduling appointments, and possibly taking time off work, only to learn your heart is perfectly fine. A 2018 analysis published in the Annals of Internal Medicine described this pattern as causing net harm, meaning the downstream testing triggered by false positives was causing more damage than the screening was preventing. If you have chest pain, palpitations, shortness of breath, dizziness, or a strong family history of early heart disease, an EKG is absolutely appropriate, and you should have one. If you're being monitored for atrial fibrillation or another diagnosed cardiac condition, monitoring makes complete sense. But if you feel well, your blood pressure is managed, and there's no cardiac history, ask your doctor to explain the specific reason for ordering it every single year. That's not a difficult question, and you deserve a real answer. Now, the next 2 checkups are gender-specific, and they affect tens of millions of people. Let's start with the men. Checkup number 3, PSA testing for men over 70. PSA, or prostate specific antigen, is a blood test used to screen for prostate cancer. For decades, it was as routine as a blood pressure reading. But the U.S. Preventive Services Task Force, one of the most respected independent medical advisory bodies in the country, now states that for men 70 and older, the potential harms of PSA screening outweigh the benefits. The reason comes down to the nature of prostate cancer itself. Many men over 70 have prostate cancer that is so slow growing, it will never cause a single symptom in their lifetime. They will die of something completely unrelated before cancer becomes a problem. But when a PSA test comes back elevated, it triggers a biopsy. Biopsies carry real risks: infection, bleeding, and in rare but serious cases, sepsis. If cancer is found, even low-risk cancer, many men are pushed towards surgery or radiation. Those treatments carry their own serious consequences: permanent incontinence, erectile dysfunction, and cardiovascular complications. A landmark study published in the New England Journal of Medicine followed men with low-risk prostate cancer for 15 years, comparing those who underwent aggressive treatment with those who were monitored carefully without intervention. Survival rates were nearly identical, but the men who had been aggressively treated had significantly worse quality of life. They traded years of health and function for a survival benefit that wasn't there. Let me tell you about a patient I think about often. Harold, 74 years old, retired, active, completely asymptomatic. A routine PSA test came back slightly elevated. Over the next 14 months, he endured biopsies, specialist consultations, and ultimately a surgery that left him with permanent urinary incontinence. When his case was reviewed by a second team of oncologists, their conclusion was that watchful waiting would have been the appropriate path. Harold's case is not unusual. Researchers estimate that PSA screening causes significant overtreatment in older men, with real and lasting consequences. For men in their early 60s with a family history of aggressive prostate cancer, this conversation with your doctor is still absolutely worth having. But for men over 70 who are asymptomatic and otherwise well, the evidence now leans strongly towards skipping this test, or at minimum, having an honest discussion about what a positive result would actually mean before you agree to it. Checkup number 4 is for the women watching, and it surprises many people. Annual PAP smears after age 65 with a history of normal results. For decades, the PAP smear was a non-negotiable annual appointment. But the American Cancer Society, the American College of Obstetricians and Gynecologists, and the U.S. Preventive Services Task Force all agree. Women over 65 who have had 3 consecutive normal pap smears or 2 normal co-tests that included HPV screening within the past 10 years do not need to continue screening. Cervical cancer develops slowly. The HPV infections that lead to it typically resolve or become apparent long before age 65. Continued testing in women with a consistent history of normal results generates false positives, leads to unnecessary colposcopy procedures, and causes real anxiety without meaningfully reducing cancer risk. The screening has done its job over a lifetime of normal results. Continuing it past 65 under these circumstances produces more harm than benefit. The key phrase is history of normal results. If you've had abnormal findings in the past or if your screening history has gaps, this is a different conversation. Please discuss your specific history with your doctor, but if you've been diligent and your results have been consistently normal, ask your gynecologist whether continued screening is still appropriate for you. The 5th checkup is one most people haven't thought about at all: routine carotid artery ultrasound for asymptomatic seniors. Carotid arteries run along both sides of your neck and supply blood to your brain. Screening for blockages sounds like the logical thing to do, especially if stroke risk concerns you. But the U.S. Preventive Services Task Force gives this screening a grade D for asymptomatic adults, the lowest possible rating, meaning they actively recommend against it. Here's the core problem. In people with no symptoms and no history of stroke or TIA, sometimes called a mini-stroke, carotid ultrasound produces a high rate of false positives. And when a significant blockage is found, the treatment that often gets considered is a surgical procedure called carotid endarterectomy. That surgery carries a risk of stroke during the operation itself. In asymptomatic patients, multiple studies have found that the surgical risk is not offset by any meaningful reduction in future stroke risk compared to simply managing risk factors medically. A large analysis published in JAMA found no net benefit from carotid screening in people without symptoms. The conclusion was direct: more surgeries, more complications, no improvement in outcomes. If you've had a TIA, if your doctor hears an abnormal sound over your carotid artery, or if you have significant cardiovascular disease already being managed, then targeted evaluation is appropriate and warranted. But a routine carotid ultrasound at a wellness fair or as a standard add on to your annual physical, that's one to question carefully. So here's exactly what I want you to do with this information. Before your next doctor's appointment, write down the name of every test or referral you've been given in the last 2 years. Then at your appointment, ask your doctor to explain the specific individual reason that each test is appropriate for your age, your medical history, and your risk profile. Ask what happens if a result comes back borderline. Ask what the treatment options look like before you agree to the test. These aren't confrontational questions. They are the questions every informed patient has the right to ask. The screenings that do have strong evidence for seniors include blood pressure monitoring, blood sugar and A1C testing, cholesterol panels, colorectal cancer screening through age 75, bone density scans if you have osteoporosis risk factors, and annual vision and hearing assessments. These are worth your time and your energy. As always, please consult with your own physician before changing anything about your care. Every person's history is different, and this information is meant to make you a more informed participant in your own health, not to replace the conversation with your doctor. Comment below right now with one of three things. Comment, questioning it. If you're going to bring this up at your next appointment, comment, already skipping it if your doctor has already had this conversation with you, or comment the test number you want to know more about. I read every comment, and your responses genuinely help shape what we cover next. The truth is, more testing is not the same thing as better care. The best medicine is targeted, thoughtful, and based on who you are, not on a blanket protocol. You now have the research. Use it. If this video helped you think differently about your health decisions, please subscribe to this channel. I'm Dr. Sarah Mitchell, and next week we're covering the 5 supplements that cardiologists now say are actually backed by real science, and 2 extremely popular ones. The evidence says you can stop buying immediately. That one is going to surprise you. Until then, take care of yourself. You've earned it.